इंजिनियर कॉन्ट्रॅक्टर सिलिंग पडला ते.
You don't ask the ceiling for ceiling. You don't speak about the ceiling and to come to the point. If you want to remove the bed, you can remove that bed. We can sleep on the floor. Don't tell us about the bed. The bed. आता मोठे पण सांगू नका. आमका बिया आमका important as a patient आमका.
तिथे ते बेड इम्पॉर्टंट वॉर ते
त्या आमका काय सांगू नका.
3 a.m. on 1st June, the PRO comes in and harasses and troubles the family members of the patients who are in the ICU wing. The reason is that one family member should be outside the ICU. Trust me, it is not possible. And recently, the MLA's family, that is Vinod Palekar's brother, has been admitted into the ICU. There are 5 family members outside and no one says anything to them. On top of that, there are 2 family members continuously inside in the ICU section and we are not permitted. Only one person is permitted and a log entry is made before entering in and their log entry is not being made. This is a harassment every alternate morning where the PRO comes in and threatens. When I use the word threatens, she's been telling them that if you all don't listen, I will take all your beds away. I mean, who is she doing it a favor? First of all the people who are suffering in the ICU and who are dying in the ICU, did they ask for this? Did they ask to be in the ICU? This has been the negligence of the government and that's why there are people in the hospital and there are people in the ICU at present. And yet every morning they are harassed. Why is this happening? Why rules are made only for the poor people and not for the rich people? This is the need that we need to ask because if someone like an MLA's family members inside, they get all the permissions possible. Even me as a single person, it gets very difficult to be, outside. You need 2 people because sometimes you have to run to get medicine or you have to go down to have lunch and come back. And in the meanwhile, we are called so many times in between. There is no rest and the little bit in the night that you can get some sleep, the people are being harassed in the mornings. You can see through this video what you have just seen earlier is the harassment. And this is 3 a.m. in the morning. Is that the time to wake up people and tell them that I will take away all your bed? That's why you can see that young boy who's saying that you can take away. We are ready to sleep on the floor. You're not doing us a favor. This is how the PRO is supposed to speak to the patient's family members. 3 a.m. in the morning by waking them up and harassing them. Vishwajit Rane, the Dean and Dr. Pramod Sawant. This is for you all to see. The harassment that the common man is facing 3 a.m. in the morning and that too outside the ICU wing. I hope you look into this and inform the concerned PRO to please be considerate or please have a change. She doesn't have any sympathy towards this family members. On top of that, she even says that you all are come here for picnic. This is how she's supposed to talk? We are come here outside the ICU seeing our family members die and we're doing picnic outside? Ruthless that she is, please teach her proper etiquettes to speak to the family members who are going through a lot of trauma outside. She doesn't know how to speak to the family members. On top of that, she's harassing them outside. Training should be given to this kind of stuff. Thank you.